And there is no doubt that Christmas Day will be very different for so many of us this year. And with rising coronavirus infections in England, Wales and Northern Ireland, celebrations are having to be a lot smaller. So let's have a look at the situation across the UK. 1 in every 85 people in England has the virus, according to the latest figures. London has the highest percentage of people testing positive at more than 2%. In Wales, the virus infecting 1 in 60 people, which is a sharp increase. Infection levels are also up in Northern Ireland, with 1 in 180 people testing positive. Scotland is the only nation not to have an increase. 1 in 140 people there have the virus, which is a drop in positive tests. Let's talk about all of this right now, put it in context. For those who know a lot about keeping us safe during this festive period, and we are joined by our breakfast GP, Dr. Nighat Arif, we'll speak to the Chief Medical Officer at the London Ambulance hopefully shortly. Nighat, thank you so much for joining us on Christmas Day. Where should we even start? I mean, let's start with that feeling that, I know lots of people this morning are waking up with their plans changed, perhaps on their alone for the first time at Christmas. It's tough for everyone, isn't it? Morning.
Morning. Let's face it, this is not where we wanted to be. This is the time when everybody actually, even if you don't celebrate as a religious holiday, it is a national holiday, and we are used to getting families together. We're used to seeing our loved ones, our friends. We're used to having all the camaraderie because it's cold, it's horrible. We don't get to do all the things that we want to do. The days are shorter. So actually, this is the time that we are used to spending in close proximity to everybody that are nearest and dearest. And we can't do that because the nature of the whole situation is we are in a pandemic. COVID-19 spreads rapidly under close contact. And therefore, we've got to be able to sort of follow the rules as much as possible. And you're right, nobody was expecting this. The word disappointment is something that I've heard throughout the week. And I was equally disappointed because, let's face it, for the first time in many years, I'm actually not working on Christmas Day. So I was having to change all my plans and get round the head of, what we're going to do now. And we are now in Tier 4 in Buckinghamshire. So that means no family or friends can come round. But actually, we do have a good day, sunny day planned. So you can still see somebody, but outside at a social distance. We still need to keep washing those hands and make sure that we're driving down the virus because, as you said earlier, Louise, those numbers are really grim and they're getting higher and higher.
And today is it can make people feel a little more lonely as well. So what's your advice to people who might be feeling like that today?
A lot of people have found that this is not the Christmas that they had planned because they are lonely. And also they had usually, like you said, you would go and see your family and friends. And even if you hadn't planned to be lonely, you are. So my tips to those that are on their own today, firstly, I'm so sorry that you're on your own because this is really tough. But actually make it a day where you can do whatever you want. So spend the Christmas how you want to do it. So if you want to stay in your gym jams all day, stay in your gym jams all day. If you want to eat what you want to eat, do that. That's absolutely fine as well. And it's really important that you keep reaching out. So where you would have opened Christmas presents together, well, use apps like Zoom, Skype, FaceTime, and do that together. Still watch the Queen's Christmas speech because that's always a good sort of boost lifter as well. And actually just make sure that you're still staying connected. Go out for a walk, go out for, a run if you possibly can to get that movement in, to get that serotonin moving as well. And actually, it's only 24 hours. I keep saying to people, I know this is really tough, but it's 24 hours and then we're through it, but we can get through it together. And there's loads of services out there that you can still reach out to. So if you're particularly having a really dark day, if you text SHOUT to 5258, there'll be somebody who can provide you mental health support. If you're finding that you're really lonely on your own, there's Age UK, there's British Cross, the Salvation Army. The amount of services that are up and running today, they're endless. And, GPs are around. My colleagues are still working and I commend them so much because the NHS is still here. We're still looking after people. So we need to be able to let you know that we're here and come and speak to us. We will support you.
And just tell us a little bit about what we know about this new variant as well, because that seems to have really changed things in many ways.
Yeah, the variant has really come about because we know that viruses do change. And from my understanding so far, it's just one spike. So the coronavirus has loads of different spikes, corona being crown, that's why it's turned that way. And one of the spikes has changed. But to me as a clinician, actually, I'm not worried about it at the minute because viruses change all the time. Look at the flu virus. Every year we find that the flu virus changes. So I'm not panicking, and I'm telling all my patients, please don't panic at the moment. So far, the vaccination manufacturers and the Pfizer company have reassured us that actually the vaccine, which is the light at the end of the tunnel that we've got at the minute, that still is going to be effective for the coronavirus that we're having. So we are still going to be rolling out that vaccine, and people shouldn't be deterred, particularly from those Black, Asian, ethnic minority communities who I know have had lots of misgivings around the virus. So we in Buckinghamshire are continuing to run it out. Please take that up, because we need that vaccination in order to form the herd immunity. Because let's face it, we don't want this sort of Christmas next year, do we?
We really don't. I think you're going to stay with us, would you, for a couple of minutes? We can also speak to Chief Medical Officer at the London Ambulance Service, Dr. Fenella Wrigley. Thank you very much indeed for joining us, and thank you as well for all your hard work on behalf of everybody who's been working for the NHS as well over the last year. Just tell us what the situation is like at the moment. How are you coping?
Thank you, and happy Christmas to everybody. So this is a very different Christmas for everybody, including everybody working in the NHS. And I'd like to start by extending my huge thanks to everybody, staff and volunteers in the London Ambulance Service, who are just working tirelessly. What we've seen over the last week to 10 days is a really significant increase in 999 calls coming into the London Ambulance Service. We normally see around 5,500, and we're seeing about 7,500. So what we really need everybody to observe the government guidance around social distancing and protecting themselves, and calling 999 for life-threatening emergencies, and using our fantastic 111 service for advice about less urgent things.
And just to reiterate, you are available there, though, if people need to dial 999.
We absolutely are, and the NHS is open. So for patients who have got chest pain, signs of a stroke, who have collapsed, we absolutely want them to ring 999. The NHS is safe, and we will be taking them to a hospital where they will be looked after by the experts in the hospital. But for patients who have got a sore throat or a bit of a cough and are able to carry on with their normal day-to-day activities, albeit feeling a little bit under the weather, then 111 will be able to provide really good advice.
Fenella, you may not be able to say, but of that increase in the number of calls, do you know how many of them are COVID or coronavirus related?
So London Ambulance Service doesn't test for the coronavirus, but we are seeing a significant number of patients who are ringing with symptoms that would suggest they may have COVID-19. So the community transmission we know is on the increase, which is why the washing of hands, wearing of masks, keeping socially distanced at this time, which is really hard during Christmas, but it's really important.
And of course, it's a massive impact on all of your staff. How are they coping?
So our staff, like all of the NHS, are working really hard. They're all here on Christmas Day, right across the NHS, to look after patients, and they're an absolute inspiration to everybody. They're here to look after everyone.
And Nighat, just a question before we go. I mean, I suppose, we've been speaking to you over these many months. These have been really just a little bit of reflection, actually. It's been really tough, hasn't it?
Yeah, it has. And it's changed the face of general practice. It's changed how we interact with people, how we communicate with people. We're talking via screens. We're using different ways of now non-verbal signs. You have to be really clear about what you mean when you say something. And that's the nature of the beast. But actually, we've adapted really well. We've learned how to cope with those Teams meetings that we've had and those Zoom calls. I've been on every week trying to grapple with technology with you guys. So I know it's been a real struggle. But actually, do you know what? It's in some ways, a lot of my patients have been really understanding. They understand the pressures that my colleagues and the NHS and the 111 services and even the testing service, if anybody wants to get a test, it's 119 if you need one over the holiday period. And testing has got so much better. So they are really understanding and accommodating. We just need to carry doing that. And communities have come together. We've managed to sort of support our local businesses as much as possible. We've tried to checking in our neighbours. We try to make sure that that person who hasn't come out for a couple of days, that will just knock on the door and make sure that they're okay. And that is amazing, because I think that's the spirit of community. And that makes me feel very happy as a GP, because that's the whole point, that although we are physically distanced from each other, that we're still checking in. And I commend all the viewers and the British public for helping us, because we know that we can drive the number down, and that only comes from us guys playing our part.
And Nighat, you know what? I've never actually, I don't think, met you in person. Or have we? And I just feel like we've become...
We met.
I just, over the last, 9 months, we've become friends, and it's just really wonderful. So, Nighat, thank you for being a friend of mine, a friend of the programme, for all your wonderful messages. You've been brilliant. Dr. Fenella Wrigley, good luck as well over the next few days. Thanks both.
Thank you very much.
I love the jumper. I forgot to tell her that. She'll have heard me. So snow, wow, has fallen in parts of eastern England, with the Met Office